Welcome everyone to another wonderful episode here, Jaws Podiatry. We have a very pleasant patient who has presented. This is not the first time she visits us here at our office. We've seen 2, we've seen 3, we've seen 5 years. But this patient has been battling the heel pain on and off, for 10 years. Think about that for a second. 10 years. That would make me 30 years old. Nonetheless, we spoke about available treatments. We spoke about the trifecta, the plantar fasciotomy, the microtenotomy, which is the deep dry needling, as well as the PRP, the platelet-rich plasma. So we have, as a unit, we have agreed that we're going to only do the Bifecta, right?
Yeah.
Which is the microtenotomy, the deep dry needling, as well as the PRP. And see how that goes. Hopefully we're on a down dip now and ready to go get better, right? So Wesley, I want you to really get close up here and personal. So again, the area is already numb. We numbed the posterior tibial nerve. It's got a couple little branches here. We also numb these little branches, and we're gonna go ahead without further ado, just kind of a little bit there. Okay, how about here? Any discomfort there?
A little bit, but not major.
Okay, is it tolerable?
Yeah, it's like mushy, dull pain. Not sharp.
I say it and I'll say it again. I love this procedure. I'm in love with it. Why? Because it works. That's why I love it. I mean, I love my family and I love my wife, but I love this procedure. Wesley, I love you too. We love everyone here.
Love you too, Doc.
And Dr. Kushner, we love everyone. I don't want to leave anyone out. And we love our patients, of course, right?
No, thank you.
Okay, so we're done there for the first part of the procedure. And now, we isolated about 26, 27 cc's, plus or minus, of blood. We centrifuged the blood, we spun it, and this is what came out, the PRP. So now what we're gonna go ahead and do is, I know that she felt something around here, so I'm gonna go ahead and try to inject from this side and from here to try to avoid this area. As we all know, PRP can be a little bit uncomfortable. So we're gonna go ahead and move in from this side. Okay, sorry about that again, Wes, it's my fault. Okay. So we come in from here, the patient should not feel this.
Nothing.
Good. Okay. And now we're going to start the infiltration of the PRP. If you feel any discomfort, please let me know.
Okay. I'm good.
Okay? So am I. So again, I like to really infiltrate slow to make sure that we maintain and keep all the goodies in place.
Mm-hmm.
This particular patient, we had a hard time numbing a little bit. Patient actually disclosed that to us, that every time she goes to the dentist, they have a hard time numbing, right? And there are people that metabolize anesthesia a little bit different than others. What does that word mean? It means that it breaks it down. So what may work for her may not work for me. Maybe it takes 4 cc's for my heel to be anesthetized, and for this patient maybe 20 or 15. So we're just slowly infiltrating. Slowly. Has to be slow. Any discomfort?
There's a little fullness, but
A little fullness? Okay.
yeah.
I'm also in love with this procedure. It's not Botox.
No, it's not.
This particular patient is in the dermatological field of medicine. It's no big deal. It's only the other end. To the last drop.
Oh.
Okay, so let me just put this down so I can just. Okay, so just a quick recap. We have a young patient, chronic heel pain times 10 years. I would say on and off. Patient presented, we tried some conservative treatments. The patient has tried other treatments as well. And unfortunately, I like to call this the tipping point, right? Something's got to give. People don't really understand that we don't walk on our hands, we walk on our feet. The magnitude of how something like this can affect daily life activities. Has it affected your life, your daily life activities?
Absolutely.
In what way?
Everything I do hurts. And then towards the end of the day at work, I start experiencing hip pain, back pain, just tired, cranky.
So this is the typical, and I've posted some videos on the hamster wheel. This is the typical hamster wheel scenario where you know, it's just that vicious cycle. It just, you keep on trying and trying and trying, and you can't get off at all. And you start to feel better, then you start to feel not better, and then better, and not better. And just when you think you're feeling better, then you take another dip. And that's the reason why people wait so long to come and seek care, which is, I guess, normal in a sense. Because if you're feeling better, why am I going to go see the doctor?
Yeah.
And then all of a sudden you take that dip again. So by the time that, you know, before you realize it, you're 3, 4, 5 months into this ordeal. You're now sitting in a chronic stage. It's not acute, subacute, chronic. And now you're like a salmon swimming against the current. And you're trying to get better, but you can't because now it's too late, right? And that's why we have to, unfortunately, do, you know, procedures as such to try to get that chronic stage to a subacute stage into an acute stage. I hope I haven't confused anyone. Like always, www.jawspodiatry.com, Instagram Dr. Tojam, Facebook Jaws Podiatry, and last but not least, our Jaws Healthcare YouTube channel. Thank you for interacting with our procedure today.
You're welcome.
We always enjoy having our patients interact. Have a nice day.